Hi and welcome. I'm Myra Jones-Taylor, the Chief Policy Officer at 0 to 3. We're glad you have joined us to learn about the state of babies today in the United States. The State of Babies Yearbook 2020 takes a holistic look at the nation's babies and presents a snapshot, nationally and by state, of how infants, toddlers, and their families are faring based on nearly 60 indicators of well-being in 3 domains: good health, strong families, and positive early learning experiences. Our goal in developing the State of Babies Yearbook is to give policymakers and advocates the information and data they need to understand how babies are doing across the country, where they're doing well and where they face challenges, and also how to use the data to shape policies that improve outcomes for young children. For some states, this may mean building on the strengths of existing practices or taking innovative new steps. This year's report presents a deeper, richer portrait of babies than in our first yearbook in 2019. We have taken a closer look at the experiences of children of different races and ethnicities, income levels, and where they live. Wherever possible, we describe inequities experienced by babies and families. And we are pleased this year to be releasing with the yearbook a brief specifically focused on the serious disparities in maternal health and birth outcomes. But one of the most important aspects of the 2020 yearbook is that it gives us the state of babies before the coronavirus pandemic hit, with its terrible health implications and wrenching economic dislocation. We know that opportunities to grow and flourish are not shared equally by the nation's infants, toddlers, and families, due in large part to past and present systemic barriers to critical resources, such as limited access to quality healthcare services, stable housing, reliable income, and employment, as well as affordable quality childcare. We are honored to be joined by Wes Moore, the CEO of Robinhood, to discuss these issues and the State of Babies Yearbook findings. To better understand our conversation today, let's meet a few of the families being affected.
Hi, I'm Shanita Buckner.
I'm Jason Buckner.
And this is our son, Caden. He is 3.
And this is our youngest son, Cairo, who is 10 months old.
Hi, my name is Charlene Flores, and I am married to my husband, Daniel. We've been married for almost 4 years. We have 2 sons, my stepson, Eden, who's 7, and our son, Avern, who will be 2 next month. And we live in Louisville, Kentucky.
Hi, I'm Morgan Briggs. I am from Idaho Falls, Idaho, and I have 2 beautiful children. They're twins, and they are awesome.
Okay, my name is Teresa. We live in Garden City, Kansas.
My name is Martin, and we have 4 kids, 4 daughters.
My name is Nalini. I'm 12 and I do swim. My name is Gisela. I am 11 and I like to do soccer.
My name is Alade and I'm 7 and I like to do soccer.
And the baby, her name is Eviana, and she loves to pick on sisters and run around.
And bite me.
Hi, how is everybody doing? My name is Rashawn.
Hi, my name is Disney. This is the Hudson family. We are from Miami, Florida. We have Brody here and Braylon.
The families we are hearing from today will share their stories of the everyday challenges they face in the midst of the coronavirus pandemic. We are honored to have them with us, as their voices are too important to be left out of this conversation. We asked them about key issues such as how they were doing physically and mentally and financially, and how they were able to be present for their children. We know from the State of Babies Yearbook that these challenges exist. We also know they are getting worse because of COVID-19, and that's what we'll dive into today.
I get food stamps, which has been an amazing help because I don't know where I would be without it. So, we had a week where I couldn't go to the grocery store and get, anything that we needed. So it was like an episode of Chopped, and I had to open my pantry and be like, what can I make with this, and this? Which was the weirdest feeling because I've never had to do that.
So both Caden and Cairo have severe gastritis. They have significant allergies to dairy and soy, as well as some different wheats and grains. Their lactase and palatinase levels are low, which cause inflammation in their intestines and in their GI tract. So both boys are seen by a gastroenterologist.
So my son is currently on a Medicaid waiver in Kentucky, but the process to get him on that waiver and get his Medicaid was long and grueling. He was injured at birth, and it took us very nearly a year to get him on that waiver. We had to restart the process multiple times for various reasons, but we finally got on the waiver and the Medicaid, which is amazing. And it has been an incredible help to us for everything, but especially during the pandemic.
So a little bit of anxiety stepped in. My doctor's appointment was very different from 2 years ago when we had Brody. Doctor appointments going into the pandemic was no more. They were cut. My OBGYN called and said, hey, your appointments are canceled. Do not come in.
I am so pleased to welcome Wes Moore, CEO of Robin Hood, combat veteran, Rhodes Scholar, social entrepreneur, best-selling author, so many things, to help us put the State of Babies Yearbook 2020 and the COVID pandemic into context. Wes has thought deeply about the intersection of poverty and health and the ways in which our policies and our expectations can set children on radically different trajectories in this country. Wes also thinks deeply about data and the power of telling a story and the power of helping us change outcomes for young children and families in this country. So it's truly an honor to have you help us dig into the State of Babies Yearbook today. But first, before we go there, Wes, I really just want to know, how are you? How are your children? I know you're in your family. I know you're in New York City. I would just love to hear how you're doing and what you're hearing about the need there and how it's being met.
Bless you, thank you, and thank you for the chance to join you for this, Myra. I'm such a deep fan of you and of 0 to 3 and all the work that's being done and the necessity of it, and particularly right now. So this is very exciting for me, and thank you for asking. Yeah, I mean, we have my wife and I have an 8-year-old daughter and a 6-year-old son. And you know and watching how they've been able to make this transition, you know, it really is kind of their strength and their adaptability, which has been incredibly, just inspiring to me and my wife. As you know, pretty much overnight, they now had to transition into distance learning. Pretty much overnight, they now had to understand the reality that, you know, they can't go see their friends, and they just can't go and hang out with their friends. And I think, you know, all things considered, they've actually adapted well. My daughter actually says that she now goes to Morehouse, because that is our household school. Nice. So she says she's now a student at Morehouse. But it's also is one of these things where I think the discrepancies that we see between so many kids, it's been completely highlighted in watching it, where we're fortunate that our kids had tablets and they were able to transition into distance learning. We have Wi-Fi access that we're using for this conversation right here. And we know for a fact that for the kids that we serve, for the kids that we fight for and advocate for, a quarter of all students and all children in this country haven't logged on once since school buildings have been closed. And so you see while the fact that I'm thankful to say that, you know, my immediate family is doing okay, all things considered. It's also really complicated to know how challenging this is and continues to be for so many other families out there.
No, I absolutely agree. we actually considered not releasing the State of Babies Yearbook. We were going to release it April 1st. And then as the pandemic was unfolding, we really began to question the relevance of this data. And I think as we were all focusing on our own families, and I'm so glad that your family as well. But likewise, as you think about the families that we serve, we thought, well, what good is data that tells the story before the pandemic? Yeah. And then we started thinking, actually, we know that this data tells a lot of early warning signs. It gives us a lot of signals that things were not right before. And it's really important if we're going to rebuild this country to know the before story, to build appropriately. So I would love to hear you, talk about what this pandemic has done for children in this country, what it tells us about us as a society, and what it tells us about what we need to do differently moving forward.
It's such an important point because I think that the context of everything we're seeing at COVID-19, it matters. When we look at the devastation that this virus has brought to our doorsteps, frankly, it is heartbreaking, and it's not at all surprising because our communities were dealing with these issues even before anyone knew what COVID-19 actually was.
That's right.
So whether it was COVID-19 or whether it was asthma, whether it was COVID-19 or whether it was diabetes, we've had these issues that frankly have gone unaddressed for an incredibly long period of time. And the danger that we're seeing with COVID-19 is how it is so systematic in the way it attacks the most vulnerable, right? So if a person who does not have a collection, does not have a pre-existing condition, has proper healthcare, all these other things, COVID-19 is damaging and it's dangerous, but it doesn't have to be deadly, right? That's what the data continues to show us. Where it really becomes deadly, it's for people who had, in some cases, not just pre-existing conditions, but in many cases, a whole battery of pre-existing conditions. For those who don't have the ability to social distance, for those who don't have the ability to work from home and protect themselves, for those who don't have proper PPE every time they go out into our society. And so what that oftentimes means is it attacks oftentimes communities and families that have been the most vulnerable in the first place. And so when we're watching these impacts and why I think your data becomes so important, the context does matter. The context of how babies were doing even prior to this does matter because it's not just important, it's predictive. When we're watching at the damage that COVID-19 has done to so many of our society, and the fact that if we're not willing to address what we saw in your data prior to COVID-19, then we are definitely not prepared to address the data that we're now seeing after.
Oh, that is so true. That really resonates with me. And we've been talking internally about this as being, the COVID pandemic was really an earthquake, right? It was this disruption that happened and it hit everyone. We're all feeling it. But there's a tsunami that often comes with an earthquake, right? It disproportionately affects those who can't get to higher ground. And the people we're talking about are those children and families who can't get to higher ground because of all of the other earthquakes they've sustained for decades in this country, right? So when I think about that, it's really powerful. And I think one thing that we're so happy about with the this data that we have now is that we're able to actually disaggregate by race, by ethnicity, by income, and by location. So urbanicity, or if you live in a rural community. And what we're able to look at when we have that data is to be able to tell that story of these subtle earthquakes that have already been happening, and then what this tsunami of a pandemic does for those families that are overburdened and under-resourced. And so when I think about that, I think about what you've seen in New York and the work that you've been doing for so many years personally and in your current role as CEO. And what are the things we really need to be thinking about in particular when it comes to health? So it's the thing I really want to dig down deep. You talked about health a little bit earlier. When you think about the fact that the families we're talking about are the families of color, and we know now that the majority of babies in this country are babies of color, and they're the families that are already being disproportionately impacted by our failed system, and then this tsunami hits. And so what does it mean for them when they have not had access to health care? When their healthcare is tied to an employer and they're already working multiple jobs that don't provide for healthcare, what does this mean for those families that we care so deeply about? And then what does it mean for our vision for moving forward, especially when it comes to health and healthcare and things like that?
Sometimes people will say to me, they'll say, why is it race always comes up when you're talking about this stuff? And my answer oftentimes is, it's not that I'm driven by race, I'm driven by data.
Mm-hmm.
And you can't look at the data, and particularly a disaggregation of the data, and not continue to see threads in every single data set that we're talking about. When you're looking at the probability for having babies who are born healthy into this world, when we're looking at the probability of actually being able to put babies and children on proper pathways for educational success, we cannot ignore the fact that the disaggregated data of looking at race matters in all of this. We cannot ignore the fact that even when you disaggregate the data, when you're looking at income levels and class, that race oftentimes performs this perfectly concentric circle. Mm-hmm. And you cannot talk about those two things without understanding how they are all completely intertwined. And so I think we're watching that right now, where as we look at the impact of COVID-19 and the impact of COVID-19 on early childhood and early childhood work, that our ability to be able to embrace the data, call out the data in which we see it, it does matter. Understanding why that for Black and brown children, that it's not just double the transmission rate, but also the number of deaths is double when you're looking at African American and Latino communities, as we're seeing in the general population when it comes to this. And there's a whole collection of things, if we're willing to unpackage that data to understand why we are and why that is the case. When you're looking at the fact that you do have a higher percentage of pre-existing conditions that exist for half the children that are growing up in the Bronx, almost half the children that are growing up in the Bronx have a diagnosed case of asthma. And so that's not an accident. And it's not something that is some kind of secondary note when it comes to how you're fighting COVID, because again, we know how dangerous it is and how it attacks the most vulnerable. When we're talking about things like essential workers and people who do not have the luxury of staying at home or working from home, when we're talking about things like people who are doing food delivery, and people who are the orderlies and who are changing the bed sheets in hospital of people who are sick. These are people who have to go into work. And frankly, even when you're looking at how that correlates between employment, 22% of people who have now been unemployed by this crisis are people who were living in poverty before the crisis.
That's right.
I.e. people who were the working poor, working jobs and still living in poverty. And so this actually gives us an important understanding of what are the things that we as a society should find unacceptable, right? We should find it unacceptable that we have people who are uninsured. And particularly, again, when we're looking at Black and Latino children, Black and Latino families, the disproportionate measure of people who find themselves uninsured, and why we do attach an insurance plan with employment. So when you have these massive shocks to employment, you then also have massive shocks to people who are covered. How do we then create a society where we don't have to have those two things tied? How do we create a society where you can have people who are working a full day's work and actually receiving a pay that justifies the work that they're putting together? Because when 22% of people who lose their jobs were living in poverty prior to this, we know that we do not have a system, even prior to COVID-19, that actually respects and evaluates an honest day's work. And so this actually creates an opportunity for us to not just, rebuild, but to rebuild better, mm-hmm. to understand what are those things that now that we look at it as a society, we should be able to say, I cannot believe we were okay with that before. I can't believe we were satisfied with that. That addressing things around the edges is not going to get us to where we need to get to. But how do we actually reimagine a reconstructed and a revitalized society that looks at people, all people, as worthy, and looks at all people in their situations as not needing judgment, but creating a society where all these platforms actually create to something and can lift us to something bigger and better.
That resonates so deeply with me, and something we've been talking a lot at the Policy Center here at 0 to 3 is this deep fear that I have and others have that once it became revealed that COVID was disproportionately affecting families of color, Black families, Latinx families, Native families, that people were going to care less. That because for so long this has been a group of people, we have been a group of people who have people have looked the other way, have figured it's their fault anyway. They're beyond repair anyway. They're broken. Why invest? And so when the data started being revealed that this was impacting families of color disproportionately, that was my first fear. And so, which is devastating to think about. But, how do we think about the role of racism in this? And I know you touched on that a little bit, but if there are other things that come to mind when we think about the toxicity, and we talk about the groundwater, that racism is in the groundwater of this country. As we are thinking about rebuilding and rebuilding better and stronger, how do we at once think about racism at the same time?
I think it's important for our country to understand and embrace the fact that racism has been laid in through the fabric of this nation, from its origins, from its founding. And I think when people say that, there's this idea of saying, well, so why are we bringing that up? We have to bring that up because in order to understand where we have to go and the things we have to address, we have to understand what have been all the ingredients that have been baked into what we now have in front of us. And the truth is, you cannot understand the history of this country without understanding the elements of race and racism that have played into it. We can say, well, what exactly does this mean, and how is this relevant today? You take a look at it at a city like Baltimore, Maryland, for example. Which is my hometown. Mm-hmm. A city that you can't talk about what's happening within Baltimore right now without understanding the history of racism that has played into it, without understanding that everything. And we look at the map of Baltimore that is tracked along lines that was built on these things called redlining, and how redlining, Baltimore was really the original architect and home of redlining, but how that really created the entire map that we now see within the city of Baltimore, where I could stand on one street and look to my left and see homes and beautiful homes and homes that have rising value, and I could literally look to my right and see broken down, dilapidated, empty vacants. And I would be foolish to think that was an accident. Mm-hmm. I'd be foolish to think that wasn't by a measure of design, that in many ways was influenced exclusively by race, without understanding blockbusting, without understanding discriminatory lending policies, discriminatory housing policies. That race is something, and racism is something that has been baked into so much of what we see in terms of our current existence. The fact that if you look at a city like Boston, the wealth disparity between an African-American family and a white family is 10 times. Now I can tell you right now that one family did not work 10 times harder. Mm-hmm. These were things that were intentionally set into place. And so we have to be able to be honest and unpackage it. And part of the reason that we do it is part of the reason I think we have to keep on bringing this up. It's not to play gotcha. It's not to play I told you so. It's not to make a person feel bad. But the truth is that the reason that we have so many people in the situations that they are in, it's not because they didn't work hard enough. It's not because they just didn't take life seriously. It's because by design, we've had systems in place that have put people in a back situation, people that frankly look like you and me. Mm-hmm. And so how then do we come up with policies that address that in a way that is affirmative, in a way that is data-driven, in a way that is certain, but in a way that we know that the conclusion that we're looking for is this idea that we have to be able to introduce parity and equity into our conversation in a real way, not in a way that is giving lip service to something, but in a way that's actually addressing historic injustices, but with a pathway of actually creating an equitable society where things like meritocracies can actually ring true and not sound amazingly hollow to many communities where that has never been a real thing. And we can look at many of the dynamics that comes from Jump Street, from so many of our families. The fact that we have such disparities when it comes to things like when it comes to everything from maternal, from focus on maternal death rates, to preparation and child preparation when it comes to entering into early childhood ed, to things like things like the impact of summer learning loss that we have within our children. This stuff starts amazingly early. And so there is a way that we actually can address these things with a racial lens to be able to actually bring our society and our country into a better place. Something that I've mentioned before. I remember having a conversation with someone where they were talking about how they thought that 2008 and the election of an African American president and all these things would move us to a post-racial society. And I said, I think that's part of the challenge. Because the moment we think we have moved to a quote post-racial society where we no longer have to look at data, we no longer have to look at realities, we no longer look at dynamics, that actually is bringing us into a place where we're actually justifying something that we have structurally been doing for a very long time in this country, which has not been helpful. We don't want to get to a post-racial society where we're afraid to look at data, where we're afraid to understand disparity. We want to get to a post-racist society where the damage, where destinies are being determined by race content, where people end up is being determined by things that they had absolutely nothing to do with, nor anything that they should ever be ashamed of. We don't want to be afraid to understand racial dynamics, but we have to be committed to being able to move past racist dynamics. And there's a difference.
Mm-hmm. Oh, I so appreciate that. It resonates deeply. Not too long ago, recently, there was a report in the Washington Post, I think, or maybe it was the Times, that shows that the life expectancy between those in low-income communities, and again, those concentric circles of race and income are very clearly laid bare there, between wealthy communities and low-income communities. And in Washington, D.C., where I live now, it's 27 years. The disparity there in your life expectancy is 27 years between high income and low income.
My husband Daniel is a nurse. It has caused our family to have to take some new and extra precautions to make sure that our children stay safe during the pandemic. There are more people out who are exposing themselves to him, especially if there are more people out that aren't taking precautions. That increases his risk, and in turn, when he comes home, increases our risk, to the point that my husband is genuinely concerned that he will have to find another place to live if he doesn't feel like he is safe coming from work to home. And the thought of my husband not being in our home is really sad.
Our days start so very early, from as early as sometimes 5 a.m., 6 a.m., and they don't end until the wee hours of the morning. Some nights, very early in the morning, my husband is up at midnight and 1 and 2 o'clock in the morning trying to complete his task because we weren't able or didn't have the opportunity to do it throughout the day because we are caring for 2 small children. The change that I've seen in Cairo and Caden really comes down to the attention and the nurturing that they require. My kids have always been mama's boys. They love their mom. They love to be around me. But what I've noticed since we've been home is that the level of attention that they require has significantly increased. There is nothing that I can do in this house where I don't have a child who is next to me or a child who needs me. My oldest son, Caden, the attention that we're giving him, which while I would say is a lot, it's still lacking in some areas for him because we are also trying to care for an infant. So I can't give my undivided attention all the time to Caden, and I see that in his interactions with me.
It was about a week, and I honestly was not doing well mentally. I was mad all the time. No matter how much sleep I got, I was mad and I just wanted to sleep. And, luckily the kids really weren't all that demanding of me, which was a great blessing. But, as soon as those 2 weeks were up, my sister came over so I could run to the store really quick to grab some groceries. And I saw her and I just hugged her and I bawled, I cried. And so she's hugging me and I'm, hugging her back. And I literally just I went limp and I fell to my knees and I just cried. And she laughed at me and she's like, really? And I'm like, you don't understand how difficult it is to be alone and by yourself during this.
Honestly, on my end, I'm looking for other jobs and nobody's hiring right now. I probably filled out like 25 applications a day, just some of them probably duplicates, just trying to make sure I'm getting more work, more money in. And it's like everything is at a standstill, honestly. And it's kind of frustrating, but I try to just, keep a positive eye on everything.
Well, the paid leave, what it means, it means security. Because, if I was to get sick and have a mandatory 2 weeks off, where's that money coming in? But it does give me a little bit of peace of mind that, if I was to be home mandatory for 2 weeks, I still got enough money to feed the family, pay the bills.
When we think about strong families, we think about, so we've talked about health. We also we know that young children need strong families if they are going to be able to benefit from all the amazing brain development that's happening in those earliest years, right?
Yeah.
And so we touched on health, we've touched on a little bit of housing, we just brought up redlining and the racist history there. I would love to think about what the difference that cash makes in this current moment, right? Where you spoke earlier about the decline, the loss of jobs, just the absolute bottom falling out of the economy right now, and what that means in terms of the people who have been working, multiple jobs and still not able to make ends meet.
Right.
What do we do now in the midst of COVID, post-COVID, thinking about the loss of jobs, and then thinking about the role that cash plays in this? And I know Robin Hood has done some interesting work on universal basic income. And we'd just love to hear you talk about that, given what the State of Babies Yearbook tells us about the need for, or the lack of cash assistance in some communities, and what that does in terms of brain development for young children.
The introduction of cash assistance is crucial. And it's interesting because even if you look at prior to COVID-19, in fact, the research that we had done with Columbia University with Robin Hood done Columbia University showed, that close to 50% of all families could not afford a $400 shock with cash. Nearly half of our society could not afford a $400 shock with cash. Well, that shock is here. And it's right in front of us. That's and right. The only difference is it's a lot more than $400.
That's right.
And so we have to be able to provide people with the resources that they need. In many cases needed before this, but particularly that they need right now. And we need to do it in a way that happens without judgment. And we need to do it in a way that happens without cynicism. Because oftentimes when people have this conversation, like, well, what are they going to spend the money on? This idea that if I we're talking about families that were struggling to make ends meet prior. These are families who we now know, oftentimes, to the point that you made earlier, who were working at times, not just singular jobs, but multiple jobs. And still barely getting by. I mean, I think about, we're talking about families like mine, and families like my mother, who was a single mom who was raising 3 kids, and also, by the way, at the same time, helping to take care of her aging parents. Mm-hmm. And the first job that she got that gave her benefits was when I was 14 years old. Mm-hmm. The first job that she got that gave her enough money that she only had to work 1 job and not 3 part-time jobs. The first job that she got that gave her reliable hours was when I was 14.
Right.
And so if someone were to have questioned her and said, well, we don't know how you're going to spend that money. How about making sure that my children were eating, making sure that we had a roof over our head? Right now, currently, 1 in 3 families in New York, 1 in 3 parents in New York are actually either skipping meals or rationing meals to make sure that their children are eating. So we have to be able to be mature enough as a society to understand where that strength and autonomy comes from, that the strength and autonomy that we should be imparting on those impacted families, it matters. And we should be able to be thoughtful and giving without being judgmental. And I think, the second thing in terms of organizationally, even for the relief fund that Robin Hood has raised, we've now allocated a little north of $23 million. Half of that has gone towards emergency cash assistance. Mm-hmm. And the big reason for that is, if you speak to our community partners and our community organizations, if you speak with our community members, which we did consistently in saying, where do you think the greatest needs are? And what do you think the most important and effective way of addressing those needs are? It came down to one word: cash. Cash. Because at this point, when we were just simply asking people to make it through from day to day, it became amazingly complicated. And especially when you think about where even the federal support that came from emergency cash assistance, where that went and where it did not go. Because even when you look at things like the CARES Act, mm-hmm. or you look at these various acts that were pulled together that is putting cash out to people, millions of people were left out of that. So for example, if you're an undocumented immigrant, you didn't get a check, regardless of the fact that you were probably paying taxes if you were working before. So you've paid into a system. Now, even if you're undocumented, you've paid taxes into a system, but that check was not coming back to you because you don't have a social security number. If you're part of a mixed status family, you didn't get a check.
Right.
So if you had someone who's part of your family who was undocumented, no check came to you during this process. If you were working but not making enough money to pay taxes, i.e. a portion of that population we're talking about earlier, that 22% who now lost their job, but were still living in poverty prior, you didn't get a check because you weren't paying taxes into the system prior. So we have whole segments of our population, whole segments of our society, who even when you look at the federal assistance that has come on board with things like the CARES Act, they weren't part of that analysis. They weren't part of the beneficiaries. And so we have to think about ways to introduce things like emergency cash assistance in a way and do it in a targeted way that we're actually delivering cash assistance to families and to individuals and to communities that we know are being hardest hit. And frankly, in the way that we think about it right now, are also the ones who are not receiving any form of measurable support, particularly one that actually correlates to the type of damage that COVID-19 has actually done both on health and economics in our communities.
There's cash, absolutely. And the research in State of Babies makes that very clear, the importance of that assistance. And then you think about, cash, other supports that families rely on. So you think about paid leave, or they should be able to rely on, but cannot.
That's right.
Think about paid leave. We think about home visiting and the supports that, we have so many families now who are calling into us, writing into us saying that they are at their wits' end because they desperately want to be able to connect with their home visitor, but can't. They don't have the Wi-Fi. They're using their phone and can't use the minutes. It burns up their minutes, right? So how do we think about this whole system of supports that was already fragile, already tenuous to begin with, and how we think about rebuilding that, putting it in place when it comes to paid leave and the importance of that for young children. Again, the data is very clear that it's important to have paid leave, that time to just bond with your child is important. And now, of course, in paid sick leave is important if we think about just in the context of COVID. So you could talk a little bit about that and what you've seen and the role that Robin Hood has been playing in making that available to people too would be great.
Absolutely. Paid leave, paid sick leave, making sure that when we're talking about things like parental leave, that we're also talking about paternal leave. If you look at, and it's fascinating looking at the data, because if you look at this ridiculous data that shows the pay disparities that exists between men and women. And again, the fact that it's 2020 and we're still having a conversation about pay disparities of men and women is just insane to me. But if you look at where there's an explosion of the pay differentials between men and women, it happens during the years of when children enter into the equation, right? Child rearing years. The reason that becomes important is this. One thing that the data continues to show us is that you have more and a higher percentage of women who are taking off from the workforce to help raise the family, help take care of the children, and more men who do not, right? Here's where that becomes complicated and why we have to have real conversations about paternal leave, about family leave, and paternal leave as a core part of that, where also paternal leave is not just encouraged, but also put into place and mandated. Because if you have a situation where women are then taking off from the workforce and men are then not forced to, when these promotions are coming up and that type of thing, because of the presence issue, that's where you watch this explosion and this divide. Mm-hmm. And so there's a way you can actually use policy to be able to address the fact that you have this widening gap between pay differentials between men and women. And it's not just simply saying, how do we address compensation issues? That's one component. But another component has got to be how we're thinking about this idea of parental and paternal leave as a way of also helping to flatten that curve that continues to exist in this type of dynamic. And the way organizationally that we think about it, and I think the way societally, that we're all then being forced to think about it, is there are certain things that we can do from a philanthropic perspective to be able to address those issues. There's things and platforms that we fund and that we support that we think have a market impact on being able to support things like, paid leave, and being able to support things like sick leave, and being able to support individuals and families and workers who then have to be able to take time off and should have a right and the ability to take time off to be able to deal and address with issues. And it shouldn't necessarily be correlated with what's your job. Or what's the size of your business or things along those lines. But here's actually the really important thing to, I think, note as well in this is philanthropy alone is not going to fix that. Individual organizations alone are not going to fix that. For many of these issues, these are policy issues. These are issues that our lawmakers, the people who we put into office, that they have a responsibility to take these things on and to fix them from a structural basis, so that philanthropy doesn't necessarily have to come in and just plug holes on these various issues. There's actually a quote that I keep on my desk. It's from Dr. King. And the quote says, "Philanthropy is commendable, but the philanthropist cannot forget the economic injustice that makes philanthropy necessary." Right. Because that's what we're talking about. This is an issue of economic injustice. And so part of our ability in philanthropy is to be able to support items and put in capital and be able to make a difference in these individual spaces and places. But part of our ability and part of our strength is also going to be how we're using our voice to advocating for policies that matter. How are we going to use our leverage to be able to advocate for those who traditionally, historically, and continually end up being the most vulnerable within our society? How can we be thoughtful about it? When I came to Robin Hood, one of the first initiatives that I wanted to put in place was we have to add a policy wing to our work. Mm-hmm. And we actually, for the first time in the history of the organization, hired a chief public policy officer and built out an entire policy wing, because I don't understand how we can be in the change business and not have this be a core element of what a change business actually looks like and feels like. And so we've got to make sure that these elements, like making sure that we can get people universally insured, making sure that we can, extend things like disaster SNAP and pandemic EBT, and making sure that we can have all children have opportunities to have not just coverage, but meals. The fact that when we're doing things like making decisions about closing down school buildings, that's going to not just have implications on the economic, on the educational prospects of our children, but on all the prospects of our children, because our schools are also the largest mental health provider for children in this country. They're also the largest food provider for children in this country. They're also the largest physical ed and physical space for children within our society. This has implications on everything that we do for our children. And so, but these are things that philanthropy can play a key role in terms of building and working to scale and putting together best practices, things like the work of Healthy Steps, which we're incredibly excited and grateful for the opportunity to watch scale into New York and beyond. But it's also the job of our elected officials to be able to make sure that these structures and policies that we're putting in place are things that are dealing with this issue from now on. And so we no longer have to deal with them anymore.
I'm so glad you started that policy center. I definitely took note, and it is very frustrating when you're in this line of work and you don't see philanthropy take note of the importance of pushing those levers of government. So kudos to you, and smart move on the path of Robin Hood. And you already took my line. I'm so grateful. We are so grateful at 0 to 3 for your support of Healthy Steps. I mean, it is truly helping to transform the pediatric system in this country.
It is.
And, one thing that you talked about briefly was mental health. And I want to go back to that because that is something that we focus on. That's kind of the bread and butter of our organization. We were founded on the importance of infant and early childhood mental health. And when we look at what is happening now, again, we know before there were so many early warning signs that young children were not getting the supports that they needed, that there were children who suffered from attachment disorders and whatnot. And now we're also seeing that this is just exploding, right? That children are not getting the support that they're needing there. This is so unsettling for so many of us. And then those supports that used to be there are gone. And we think about mothers and parents who are writing in and calling in and saying that they are really in dire need of mental health support. And one thing that Robin Hood funds, I'm on the National Advisory Board for the Early Childhood Rapid EC out of the University of Oregon, and Phil Fisher's work on this weekly survey that is going out that is talking to families to understand what is happening in real time. So it's a great layering on of the State of Babies Yearbook data there. Right. But we'd love to hear you, and what we heard there in the recent, not too long ago, survey is that parents who have children with disabilities in particular are reporting extreme needs for mental health support. They're really crying out for help. And so I would love to hear, thinking about, again, building a better system. What is the role that our mental health providers play in all of this, that the actual system of early childhood mental health plays in this recreated, reimagined society that we need to be working toward?
I think about some of the work that Robin Hood does with something we call Fuel, which is the fund for early learning, and which is led by Kelvin, one of our remarkable managing director in our team. But Kelvin Shannon, and we talk about this often, where you look at the impact of mental health and how it starts so early, and the damage that we are doing so early by how we are introducing our children into the world and what we're welcoming them back into. The amount of ACEs that we're asking our children to endure, and then somehow ask them to compete and survive. Right. With that, I think about it in context of Freddie Gray, who was for those who remember, about 5 years ago, there's a 25-year-old man in Baltimore who made eye contact with police. And the police chased him, and he was arrested when they found when they searched him and found a pocket knife on him. And about an hour after he was arrested, he was in a coma. And about a week after he was put in a coma, he died. And this led to led to weeks of protests in Baltimore, which eventually culminated at the end of April of 2015 with unrest that took place in the city of Baltimore. And oftentimes, you think about this where, people say, well, it's horrific what happened to him in terms of his death. And that's true. But what's also horrific is what happened to his life. Mm. This was a person who was born 2 months premature. He was born 2 months premature, him and his twin sister, addicted to heroin. It took months for him and his sister to gain enough weight for them to be able to then leave the hospital on their own. Once they were able to leave the hospital, they moved to a housing project in West Baltimore. And this housing project in West Baltimore over on North Carey Street, that and over 400 other homes in 2009 were later named in a lawsuit, a civil lawsuit, because the home had endemic levels of lead poisoning inside of it. And so you now had a young man who was born underweight, addicted to heroin, living in a home that was poisoning him. And by the way, at this time in his life, he's 2 years old. He's 2.
Right.
We can't even begin to imagine the level of mental health and trauma challenges that a Freddie Gray was then living with and existing with for the remainder of his life. So when, this idea that when people say, well, people should just work harder, how hard would Freddie had to have worked in order to overcome that? The mental health challenges that we are asking our young children and our young kids to endure is absolutely heartbreaking and completely unfair. And so when we think about the work of Robin Hood, where, you think about the Fund for Early Learning that takes place, where, some of the biggest investments that we have made has actually been in this idea and in this concept of supporting mental health. Not just funding, but advocating for the fact that we should be universalizing mental health counseling for infants and parents and early childhood professionals as we're going through this process, that it should not be something that people should just get by raising their hand or if they can afford it. But this should be something that when we're talking about the true universalization of mental health supports and mental health counseling, we believe that's something that's not only a worthwhile philanthropic investment, but it's worthwhile from an advocacy perspective of things that we should be pushing for and making sure that we can then internalize and institutionalize in everything that it is that we do. Because it's difficult to talk about how do we advance our society if we don't have those basics of mental health and mental health supports that are then being undergirded, but then also being understood and addressed and appreciated for the dangers and the damages that they are already causing in the lives of our children and the lives of many of our families.
Yeah, focusing on infant and early childhood mental health is, like I said, a keystone of this organization and a big part of the advocacy that we do at 0 to 3, in making sure that those services are there, that the funding is actually there to pay for providers, and that people are aware that it's there. So I'm so glad to hear that you're doing that. That's a big part of our Think Babies campaign, which the State of Babies Yearbook is also a part of.
We are so grateful that we're still able to provide Abrin his therapies. He's really in the prime of his brain development, and to lose his services, I truly feel, and I think that his doctors would agree, would be detrimental to his development overall. Now is the time to be working with him on skills that he already has and strengthening those skills. And now is the time to be working on building new skills.
We have circle time scheduled twice a week. Right now they are scheduled on Wednesdays and Fridays for about 15 or 20 minutes. It depends on what activities are done during circle time.
I work for Head Start, and starting this week, the teacher and the parent get homework ready, and then I deliver it to the families. I leave it on the porch and families get it. And so it's just activities for the families to do together.
We haven't touched on another major part of our work at 0 to 3, and that's the belief in the importance of positive early learning experiences. And that's the third pillar, if you will, of the State of Babies Yearbook and of our policy framework overall. And I would love to just talk with you a little bit about the importance of childcare, again, in the context of what we're seeing now, right? So we are seeing childcare where there have been childcare deserts. Huge swaths of this country already have those deserts. And then you layer on, again, COVID. And the fact that childcare programs are in this bind where they cannot afford to close their doors, because if they close their doors, where's their income going to come? And we know that a lot of these federal supports, to your point earlier, are not actually helping out our childcare providers. And yet families aren't coming to them because they're afraid or it's not safe. Or if they do close their doors, so then what happens to them, right? Where are they going to get their funding? And those that do manage to actually stay open are putting themselves at great risk.
Yes.
And one of the biggest fears that we have, as this is all getting shaked out at the community level, is we are watching how childcare, which was already, again, on very shaky ground, is starting to disappear. And that whole system may not be there when we all eventually go back to work. And so just thinking about the role of childcare in child development, as well as employment, and making sure that families can get back to work and have a place to send their children that's trusted and safe. And just your thoughts on what we need to be thinking about now, and then again what we need to be thinking about post-COVID.
Yeah, it's so I'm on the New York Governor's Commission, Governor Cuomo's commission on reopening New York. And we were just having this conversation where we're saying, what are some of the prerequisites that we need to reopen New York? And actually the very first thing that came out of my mouth was childcare.
Thank you.
Childcare.
Thank you.
You know, we could talk retraining all we want, and all that's going to be incredibly important, because the reality is that for you think about many of the occupations where we have lost a significant amount of jobs. 2/3 of all jobs that have been lost in this country during this entire crisis have been in the hospitality industry. So it's been restaurants and it's been hotels. Oftentimes these are low wage jobs. So oftentimes these are entry level jobs, and they're going to be difficult jobs to be able to recover from, to be able to bring back on board, at least definitely for the short and the midterm, potentially even for the long term. But we can have all the conversations about job retraining and how do we retrain people for different skills and necessary skills all we want. But the reality is that these are not just numbers or robots or automatons we're talking about. These are people. These are parents. These are people with responsibilities. These are people with people who are accountable to them. I don't make a single decision in my day unless it starts with a frame of how is that going to impact my children.
Mm-hmm.
Right? I mean, every decision that I make first starts with what do I need to do to make sure that my kids are covered and make sure that my kids are okay? Our conversation today, the first thing you get was like, wait, so do we know what's going to happen with Mia and James during that time period, right? And I'm not alone. I am representative of every single parent out there in the world, as you are as well. And so we're fortunate that we are in a situation that there was an option as to what would happen with our kids, that we know that they're going to be okay during this time period, right? Mm-hmm. Not everyone is as fortunate. Not everyone has that as their backdrop, or when they're making every single one of their decisions. And so as we're having conversations about a reopening of a society, we have to know that decision has to be made in a context of getting people back to work also means making sure that their children are going to be okay. Mm-hmm. Because if you have one without the other, the first component will never be complete, it will never be sincere, and it will never even be done. And so there are ways when we're thinking about things like enhancing and creating platforms for a universal basis of childcare that we know all the data continues to show us has a market impact on not just entry into the workforce, but re-entry into the workforce. It's not just about how we're making sure that individual can have coverage. It's about how do we make sure that we're restarting an entire economy. Because what we have when you're talking about people who are then laid off and people who are being furloughed is these are parents. These are people who have responsibilities. And so no restarting of an economy starts without that also being part of this dynamic. One, and you bring up an important point too, because how it talks about the continuum of this work is you see the impact that childcare also has on things like mental health,
right,
and stress,
right,
and all these other factors that can then get played into how an individual or a family can then recover and respond in this time of crisis. And so we're not just doing it because it sounds good. We're not just doing it because we feel like in some way that it makes us feel good to feel like we're putting all these pieces together. We're doing it because every single one of these components is going to matter if we're going to successfully rebuild an economy and retool it so that we're actually putting people in a better place to really think about both their future and the future of our large society in a truly holistic way.
We know that this is $100 billion industry, right? And what we are seeing now in terms of supporting it is woefully inadequate, and again does not take into consideration all that you just said. And so it's really scary to think about what the reopening plans will be if we don't consider childcare. So kudos to you. I'm so grateful to you for doing that and that position of power there. We only have a few more minutes together, and I just want to talk to you, hear from you what you are thinking. We've talked a lot about the current moment, the past, and where we need to go. But what are your what gives you hope in this moment right now that we might actually come out of this looking differently and looking better and being stronger for families and for this country? What gives you hope? I need hope right now, Wes.
I know. What gives me hope? It's the fact that I am seeing and we're pushing more and more on this idea that simply rebuilding is not going to be good enough.
Mm-hmm.
I think we're challenging things that we haven't challenged before, which I think is incredibly important. I think one thing that we all have to understand and appreciate, even all of us in this field, all of us, yourself, myself, who have devoted our lives to this work. Mm-hmm. There's something I think we have to understand, and that in some ways is for all of us has been our level of complicity in this.
Yeah.
That we all deserve part of the blame.
Mm-hmm.
And I say that because I didn't fight hard enough for certain things that it's crystal clear to me that I needed to. I've always believed in this idea, for example, of universal healthcare. I didn't fight hard enough for it. The fact that a single day went by without me adding my voice to that means I was also complicit in the fact that we now have established and built up a system that was okay with having people who did not have courage, who did not have coverage, and also a system where people and their hanging on was by such a thin thread.
Mm-hmm.
The fact that I wasn't speaking every single day about the need for a fair and living wage for people. And again, I run one of the largest anti-poverty nonprofits and foundations in the country. There is no reason why we should still have a society where we have people who are working full days work and are still living below the poverty line. No way. That level of the fact that we were not all so unified in pushing for these basic items means we all should own a level of complicity in that, all of us. And so the thing that gives me hope, the thing that does give me true inspiration is every day we are seeing fighters every single day who are now owning that complicity and saying, I'm going to make it my focus and my goal to completely shred myself of that. Because not a single day can go by, nor should go by, where we are not making that a core priority of how we're thinking about a North Star for a large society. We're watching people every single day who are getting up and going and doing the work And as a larger society, you know, we clap and we say thank you for your service and thank you for your work, as if that's enough. And so the thing that gives me hope, the thing that gives me a true sense of belief that we can and will be better, is the fact that I think we collectively are owning a complicity, and we understand that we are not going to be better just because. We're going to be better because we force it. Mm-hmm. We're not going to be better because 6 months from now things will be better, or 12 months from now things will be better. Says who? Says who? Because I think we've seen the damage that 6 months or 12 months can have, or 3 years or 4 years can have, right? We now have to understand that our being better is because we force it. It's because we push it. It's because we demand it. Anything short of that, then I'm not sure what we're waiting on. And I'm not sure why anyone can tell me that things are going to be better now than better in 6 months or 12 months or 18 months or 24 months than they are right now. We have to force it. And so that level of accountability and the ownership of complicity actually gives me hope that we can do better and that we actually will do better.
I am 100% in agreement with you. And you got me all fired up. And I hope everybody here who's been listening and joining us today is also fired up, because we are complicit. We have been complacent. And young children they deserve more than Amen. What we've been giving them. And so if we do not come out of this stronger, shame on us. It's beyond shame. It feels like an existential crisis for me right now. If we cannot get out of this in a way where we acknowledge that complicity, and the only way to absolve ourselves, to your point, Wes, is to dig deep and make ourselves vulnerable in these ways, sacrifice in ways that we have never done before, so that this does not happen again.
We definitely want our policymakers to know how important childcare is and how important it is as parents and as families for us to be able to have a safe place to take our children. It would have been amazing to be able to potentially take some time off, take some paid family leave in order to transition our family into now being at home for an extended amount of time and trying to figure out, what does that mean? How do we navigate through this? So again, it's important for our policymakers to know childcare is important. We need to be able to have that outlet to have our kids in a safe place so that we are able to continue to work.
I think there are a few things that our family would like for our lawmakers to be aware of as we are navigating the pandemic as a nation. And some of the really big ones that mean a lot to our family have to do with our lawmakers being cognizant of families with members who have special needs as they make decisions about opening things back up. I really hope that they take into consideration that there are families with children who would not be safe to come to school under the current circumstances and the likely circumstances, a few months from now in the fall.
I want my policymakers to know how much home visiting has definitely been an asset for me during this time. While I personally struggle with depression and anxiety, and while this time has definitely brought out a lot of anxious feelings, my home visitor has been able to not only help my kids put that anxiety to rest, but also help me put that anxiety to rest. And I don't know where I would be without my home visitor or my home visiting program. I look forward to my visits with my home visitor because it's not just about what my kids need, it's about what I need and how I can help not only make my life better, but make my kids' life better. And if we are able to make our kids' life better, then we are able to make the world better for the future generations.
And, for those of you who are listening, there are so many ways that you can be doing this right now. A small way is to obviously check out the State of Babies Yearbook. We created this not only because we love data and we believe in the importance of being able to tell a story with numbers, in addition to the way we tell stories through our Sterling Thunder families and all the other ways that we show up for babies, and we're a big voice for little kids. But we also created this so that it would be used as an advocacy tool, so that folks out there who are in advocacy organizations or who are in concerned parents, grassroots organizers, that they will use this data and walk into the offices of power, the halls of power, and demand better. Use this information to tell a story, and to tell the story that we're not doing right by our babies. And so we hope that you will check out the State of Babies Yearbook. It's part of our incredible Think Babies campaign, where you can also get involved there. So you can go to thinkbabies.org. You can go to stateofbabies.org, where you can shake off that complicity, as Wes said, and make a difference for young children. Not just a difference, but change their entire trajectory of this country. Wes, it's always a pleasure. I just am so grateful for your voice. It's great to be in this conversation with you and in this work with you. So thank you. Thank you so much.
It's an honor to be in the work with you, and thank you for this contribution of the State of Babies, and thank you for everything you continue to do. We need it, and we are grateful. So thank you.
Thank you so much for participating in our virtual release of the State of Babies Yearbook 2020. We encourage you to go and learn more about where babies stand in your state. Go to stateofbabies.org.